Okay, Dr. Donat here. We just wanted to talk a little bit about the LuxeLift and how that differentiates our facelift from others. So LuxeLift is our state-of-the-art facelift technique, which involves both a deep plane facelift technique down the lower third of the face and neck, as well as tightening the platysma muscle in the lower neck just below the jawline back as well. And then importantly, in the mid-face and just below the eye area, a revolumization of this area where we all tend to lose volume with time. And so in this patient, we're demonstrating the effects of that. So first of all, the lower third of the face and neck, you see the rhytids in the lower face, the looseness of the skin along the jawline here, and then the blunting of the neck angle here and some excess skin down there as well. So that's the lower portion of the face, and that's addressed in most facelifts, but in my mind to really the best degree with the deep plane facelift, as well as with some additional platysmal muscle or neck muscle tightening back behind the ear. So try to just focus just on the lower face for a minute, just below the nose and around the corner of the mouth and down, and compare the two pictures in that area. So you do see a nice improvement, I think, in the lines or rhytids in the face and in the excess skin of the jawline. So she has a nice crisp jawline here, definition of the neck angle, better definition of the neck skin and neck angle, so that most facelifts will achieve that to a certain degree. Again, I feel like with the deep plane facelift you get the best result possible in that area, and that's what we do. It's not something that most people are comfortable with, but really makes a big difference. But then another differentiating aspect is the volume that you can get around the eyes, both in the cheek, actually in the upper eyelid area as well. So if you compare now this portion just from above the lips upward, you see the volume loss initially underneath the eyes, actually in the upper eyelid area here too. One of the areas that very few people address. Many are now addressing some sort of volume loss in the mid-face, but you can see that area improve significantly in this woman. So improving the definition underneath the eye, in the anterior cheek and lateral cheek, or front and side of the cheek, and overall that creates I think a big difference in the mid-face area. A lot of people talk about mid-face lifting directly. I really feel like the best results are when you revolumize that area, and that does give you some lifting, some radial lifting of the mid-face anyway. So I really like that improvement. She had no peel. You would think that this might represent a chemical peel result, but just by revolumizing that skin, she's had a rejuvenating effect really in 3 dimensions. Let's focus just on the upper eyelid then for a minute. And you can see how there's a bit of almost like a flap of skin here and some hollowness in this area. Really a concavity is in this area where the skin and soft tissue is going up into the eye socket, and that occurs with age. If you look at her pictures from her teens or 20s, you would probably see more of a highlight like this over here. And so as the title indicates there, we did not only volume restoration around the eye, but also an upper eyelid blepharoplasty or skin removal. But if we had just done a blepharoplasty or just done the skin removal, this little bit of area of skin of the eyelid itself, the eyelid portion that's right next to the lashes, would show even more. So most people, most physicians, will just remove skin, and then you end up just seeing a lot of the upper eyelid. And I don't think that's very natural, and in fact, if you look at her pictures and your own pictures from your teens and 20s, you probably see that this portion of the upper eyelid really doesn't show very much. And then if you look at people with more advanced age, particularly if they've had upper eyelid procedures in a more traditional way, then you'll see that that's very sculpted out and hollowed out, really. So what we talked about with this patient and what we did was remove a little bit of skin and then also revolumize this area. So if you come over to this one then, in the after picture, you see how, yes, she's had some of that sort of flap of skin effect removed, but that's by a combination of removing some skin and revolumizing. So that's why she has less of a concavity. She had a little bit of concavity in that area and mainly in this area. and that's been revolumized, and that's been turned more into a straight down effect. Not quite a convexity right in this area, but certainly more convex than what she had here. So long story short, more volumized around the eye, which creates more of a highlight around the eye, and which looks more youthful and more naturally youthful. So yet another way that we feel like the LuxeLift is a more natural and better restoration of the face than traditional means. Thank you.